So many other groups are looking at dual targeting approaches, and they've all been impacted in different ways by different advantages and disadvantages of the study design that they've taken forward. As I mentioned, we've had other study designs that have been more or less successful in different areas, and we've learned from those and gone forward with the current study. But we've also, there are many other international groups doing the same. So there are dual CAR targeting approaches from groups in Seattle, from groups in at UPenn, and from groups at the NIH. So what we've learned so far is that within the field, dual targeting is effective, but whether it actually reduces the risk of relapse overall is only going to be possible if you can get persistence. And so far, persistence has been a major issue for many of the studies. And the main problem seems to be that CD22 CAR signaling is very difficult to achieve and make sure it's effective. So I think other groups are kind of going through those steps just as we have done to try and get the most effective, most sensitive CD22 CAR. And the data from a cohort treated at the University of Pennsylvania with a serial approach, so they treated with CD19 CAR and then CD22 CAR in adults, that shows promising data, but they reported very early at ASH, and we'll be interested to see what happens next. The Seattle group went forward with a CD19, CD22 CAR product. They've carried out a few adjustments to try and make their CD22 CAR more effective and signal better, and their data are hopefully going to come out soon with that cohort, and we'll be very interested to hear their results as well. So that's sort of from the field of dual targeting approaches. We all want to work on persistence and the biology of persisting CAR T cells. So that's work that myself and others are taking forward. That's going back to very basic science to try and understand what it is that makes a CAR T cell persist. But we know that persistence is half of the story in terms of ALL, the other half being antigen negative escape. So if we can tackle from those two different fronts, then hopefully we'll really advance the field in the next few years. And then everyone's trying to move CAR T cells forward in other disease indications, particularly AML is something that I'm interested in, and others are as well. But I think those environments are going to be very, very difficult. But there have been a few sort of incremental and very exciting studies that show that we're starting to break through into new indications now. And those were subject of many of the abstracts in the sessions that I chaired here at EHA.